If you have hypertension, if you have diabetes, I don't want to talk against people that say it's online. If you can take this drug, the BP will disappear. If you take this one, fibroid will disappear. I don't want to talk about against anybody. But what I'm telling you is medically, this blood pressure arises because of two things. Either that the artery has become so thick, or that the heart is pumping stronger than normal. If we give you a drug, we give you a drug that will relax the artery, or we reduce the force and power of contraction. Why are we doing that? Because that is the pathophysiology of the ailment. This is where we will catch it from. Is it clear? Now, there is another condition we have, which most people will get wrong. Sometimes somebody will tell you, I have hypertension, but I usually know when my BP is high and I will take the drug. You ask that person, how do you know? He say, you used to have headache here. No, no, don't any issue, go. Whenever you see any symptoms, BP has no symptom. Unlike diabetes, which has symptom of frequent urination and water, BP ain't one symptom. That is why it is called a silent killer. Because there is no sign, there is no symptom. The only sign he can wait up that person went and checked his blood pressure is high. Some women will tell you now, I don't used to have BP. It is only when I'm having malaria. Malaria does not cause hypertension at any time. In fact, one of the features of infection or sepsis is that the blood pressure will go down. Sepsis actually causes the blood pressure to go down. So if somebody is having malaria, for example, and you go to the hospital and check your blood pressure, and you get something like 160, you're telling me it's not that the malaria that is causing the BP. The truth is that your BP has been 170 or 180 before the malaria. The malaria actually brought it down a little bit. Because one of the things about malaria is that it brings down the blood pressure. It doesn't hide it. But the truth is that some people remember to go to the hospital only when they are sick. And by that time, they will now check the blood pressure, it is high. They will now say, no, Makaroko. The BP was there. The only thing is that you never bother to check. It is only when you now fall sick that will now remember that you can go and check your blood pressure. On that note, you now realize that it is high. I don't even understand. So, but once this diagnosis has been made, the idea is that there are some deaths. There are some people you will talk to. Say, look, I do this. Or say, oh, one thing must kill a man. Sometimes you will tell them, go to the transformer, go there and hug it and die. That is one thing that will kill a man. Why being careless with your life? Somebody will just tell you, don't do this, or say one thing must kill a man. And eventually you see people dying careless death. One day we were in a conference in Abuja. One professor came and asked us, what is the commonest cause of death in Nigeria? Some people were saying hypertension. Some people say diabetes. Some people were saying HIV. Some people say malaria. They said all the things. The people say no. We now asked him, what is the commonest cause of death in Nigeria? He said it is ignorance. People are so ignorant of the whole situation. One person will just think one thing, another person will start doing it. Just take for example. If somebody comes and say, I'm feeling weak, and you do my malaria test, and you realize that she has malaria, what brought about the diagnosis is what? Weakness. Sometimes what she just needs is give her anti-malaria. Manonga saying it's typhoid. I don't know who tell the shoji that the malaria must come with typhoid. Secondly, is that sometimes all you need is that anti-malaria. It is not all the time you take anti-malaria that you take paracetamol. You only take paracetamol if fever is there or headache is there. And you must not take it for the 3 days that you take your anti-malaria. It's not necessary. On the first dose you have taken, you can take it with paracetamol. Assuming there is headache or body ache, you take it with paracetamol on the first day. Second day, the drug has started working. The muscle pain is no longer there. The headache is no longer there. All you are doing is just to complete the anti-malaria. It is no longer necessary to continue it with paracetamol. Why? What are you taking paracetamol for? Because the paracetamol is just symptomatic. It doesn't cure anything. And sometimes it is good you stop taking the paracetamol to be able to actually know when you have actually been cured of the malaria. Because if you keep taking paracetamol, the headache will not be there. You will not know whether the malaria has gone or not. That fever you see sometimes is what you call inflammatory response. It is helping the white blood cell to actually multiply fast. By the time you are dampening it, you are reducing the rate of production of the white blood cell, and somehow it might affect your healing.